was given to me a bit later and there, so I had to modify a little bit, but not the contents. Contents, alhamdulillah, are same. So, but there'll be a bit of revision and repetition. So we are doing this healing and repair, which involves a lot of growth. So we were asked to revise the cell cycle because there are many important points in the cell cycle which we need to revise. So we all know about the cell cycle, the G1 phase, the S phase, G2 phase, and M phase. Are you aware of it? Yes, I will be expecting answer
yes,
because this is revision. So what, who is answering?
Me, doctor.
Your
Muhammad
name,
Samir.
sir?
Muhammad
Muhammad.
Samir. Yeah.
Okay, Muhammad, what is G1? What does G stand for?
Generation 1. It's preparing
For synthesis.
stage.
Okay,
Yes.
G1 is for. So there's some G. Usually we think it stands for gap. There's a gap. There's nothing happening. It's happening in the background. Then S phase is the synthesis phase in which the DNA synthesis occurs. Then G2 phase is for preparing for the mitosis. M phase like. We'll come to the labile cells and the stable cells later because it was on the slide, so I wrote it down. But we'll understand them later on. So going to the cell cycle. This is a very good diagram to understand all these methods. You again see the G1 phase, the S phase, the G2 phase, and the M phase, okay? And the G0 phase. And also we see that there are epidermis at the top. Can you see the pointer? My pointer is visible? Mouse
Yes,
pointer?
doctor.
Okay. So at the
Yes.
top, you can see the epidermis. What are epidermal cells? They are continuously dividing. They are continuously cycling cells. They are called labile cells. So epidermis is one of the example. Then here at the bottom, we have this on this side, we have the hepatocytes. These are the quiescent cells. They are quiet, but they can divide. They are called stable cells, right? Hepatocytes are stable cells. But finally, the third type are non-dividing or permanent cells, the heart cells and the brain cell, the neuron cells. So on the basis of proliferation, we classify the cells in the body in three types: labile cells, stable cells, and permanent cells. The labile cells, just now we saw that they are the cells which are always dividing, even during the health time, all the time. The two examples are the surface epithelium, the surface epithelium of the skin, the columnar epithelium of the GIT, and the transitional epithelium. We know where is the transitional epithelium, Muhammad? Anyone? Where is the transitional epithelium?
In the bladder?
Yes,
Bladder.
mashallah, mashallah, very
bladder.
good. Alhamdulillah. So it's transition in the urinary tract. We have the transitional epithelium. So they are dividing all the time. The second organ system dividing all the time is the bone marrow cells. They are also dividing all the time. So they are called labile cells. So any injury to these cells is not so a problem because they'll quickly regenerate. They'll quickly grow again. They are called continuous replicators, labile cells, etc. The second type is the stable cells. They are normally not dividing. The liver cells, the kidney cells, and the pancreas cells, they are not normally dividing. But if there's any injury, they can divide, they can regenerate. If the injury is small, then they can regenerate. But if it's large damage, then they cannot divide. There's not complete regeneration. They'll be repaired with fibrosis. I'll show you the example later on. So these are in the G0 or G0 phase of the cell cycle. They are there quietly sleeping, quiescent cells. They can divide only when there is requirement. Okay, so they are in the G0 phase of the cell cycle. The permanent cells, by definition, they are the cells which are in the heart and in the neurons of the brain and the spinal cord. They do not divide by definition. That is an old theory, but now recently, after 1980, I think, they found that these can also divide. The neurons can also divide, but to very limited amount. The neurons in the hippocampus gyrus and the olfactory bulb can divide, but very little. So there's no regeneration actually. So that is why they are called permanent cells. So whenever there's an injury to these two organs, there'll be scar formation, there'll be collagen formation. The examples are the nerve cells and the cardiac cells. So the three types: labile cells, stable cells, and the permanent cells. Coming to the definition of healing and repair, again, there's a lot of confusion of these words. These two words, healing and repair, are the common English words, so they are used interchangeably. So in pathology, we get confused. Sometimes they are just using the word healing, sometimes they are using the word repair. But regeneration is more specific. When we say regeneration, it is more clear. But otherwise, these two words are mixing up. By definition, healing or repair is the replacement of the body by the dead and destroyed cells by the living cells. When the cells get destroyed, they get necrotic, then living tissue is added there. This is called healing. And in this process, two types of things occur. One is regeneration, the other is repair by fibrosis. Again, another complication is that some people call demolition as a part of healing. And some say, no, it is part of inflammation. So that is not a big problem. Main thing is the understanding of replacement of this tissue, which occurs in two types. This replacement occurs by two ways. One is regeneration. When the cell which dies is epidermal cells, it is replaced by an epidermal cells, we call it regeneration. If a cell which dies is a liver cell, it regenerates into a liver cell, we call it regeneration. But suppose a cell in the heart, it dies, it is replaced not by the heart cell, by a fibrous tissue or scar tissue, we call it repair. Repair by scar formation. So these are the two types. Regeneration, when by the same cells. Repair, when it is by the collagen tissue or scar tissue. Most of the organs, they have both the structures, so special structures and uncommon structures, so there'll be a mixture of both mechanisms, regeneration and repair. So this is a good diagram, which is I added, it was not in the original slide. So you know all about photoshopping. Is it clear? Do you understand the diagram?
Yes.
Mohammed? Yes, very clear. See, if on the left side is the main building. If you build the same, if it is destroyed, you build it exactly the same, it is regeneration. But if you try to build it irregularly, it becomes a repair. And this other cells are there, irregularities there, so that is repair. But this is not photoshopping. This is an actual building in the city of Prague. And this building is called Dancing House. So in this, you can see there is a difference. They have tried to build like this. And it is a good example of repair or healing with collagenous tissue. Regeneration is the basic one, which we'll start. In this, it depends on three things. The cell types, which we have already done, labile cells, the stable cells, and the permanent cells. If the permanent cells are damaged, regeneration cannot occur. If it is in the labile cells, they will be completely regenerated, clear? But the second type is the tissue architecture. It's not so clearly classified that some structures, they are simple, they will regenerate easily. Some are complex, so they will not regenerate easily. They will have other component also. There'll be a mixture of regeneration and healing. Similarly, amount is important. If there's a big burn on the skin, on the hand or the body, so big areas involved, then the epidermis will not regenerate because it's a large area. In that, we have to do the skin grafting and big surgeries are done to put that skin on the top. So amount is also important. Just now we are doing it again and again that regeneration can occur in the labile cells, in the surface epithelial cells, in the bone marrow cells, and it is easy. It can also occur in the stable tissues. Very good example is the kidney transplantation and kidney donations. Some person gets a failure of both kidneys, then their relatives, the son or the nephew or the niece, they donate their kidneys. Then if they give one kidney, the other kidney will hypertrophy and hyperplasia. Normally it's not dividing. Both the kidneys are there, no division. But one person donates one kidney to relative or someone, the other kidney will get enlarged and it will get hypertrophied and hyperplasia, and there'll be growth in it. So that is a good example of regeneration in the stable tissue. The other example is liver. Surgeries like partial hepatectomies or lobectomies, when there's a tumor in the liver, they remove half of the liver, the other half can also grow. So we'll see these two examples just now. I hope it's okay. I'm going fast, or you want me to go slow?
No,
it's good.
okay.
It's fine,
Yeah.
sir.
It's okay.
It's good.
Alhamdulillah. If anyone, I
understand.
understand there's a language problem. So since my 10 years here, always I get a complaint that Dr. Akbar speaks fast. So I also started going fast because we were late and Dr. Ahmed wants some time from your lecture. So anyway, we come to the examples. Take the example of the skin. Skin, we know that is composed of epidermis and dermis. The epidermis is the stratified squamous epithelium, which are labile cells. They are always dividing the epidermis. So whenever only epidermis is involved, only superficial epidermis is involved, then there will be regeneration. But if the dermis is damaged, in which there are sweat glands, there are the hair follicles and the muscle erector pili and sebaceous gland, then there will be repair in the dermis because it is not specialized. It's not always dividing. So this is not a labile. These are not labile cells in the dermis. So skin, if only superficial involvement, then complete regeneration. If the whole skin is damaged, then a combination of both occur. The example, this is a very good CT scan before removal of the right lobe of the liver. This is the right lobe of the liver. It had some problem, some tumor or something. Before the surgery, they took this diagram and this CT scan, and they removed this part, the right lobe. This part was removed. And this, you can see that the left lobe is small here, very small. But after 1 week, you can see when the right lobe was removed here, and the left lobe has grown up. In just 1 week, the liver cells started growing. So although these are stable cells, normally they don't divide, don't grow. But after surgery, the liver cells have divided and grown so big. So this is the example of regeneration in the stable cells. Now coming to the repair, which is actually the scarring or the granulation tissue. So whenever there is repair by fibrosis, healing by fibrosis, I'm using both words to stop confusing, and very commonly people call it scarring, scar formation. So this is the healing in which a non-specialized tissue, the collagen, is formed. So this is the normal, and during this process of formation, the collagen deposition is done. Before that, there is another tissue is formed called granulation tissue. This is a very important tissue, which is a kind of a immature collagen. This will mature to form fibrous or scar tissue. So whenever there's damage, a large damage, first the granulation tissue is formed. It's like a baby tissue. It is an immature tissue. It matures. This is the bottom one is the granulation tissue. It matures into this collagen, the scar at the top. So this is the granulation tissue at the bottom. You can see a lot of blood vessels in it, capillaries, and we will do more in detail about it. So whenever there's repair by fibrosis, healing by fibrosis, granulation tissue is formed, which matures to form the fibrous tissue or the scar tissue. The picture at the bottom is the normal H&E, the routine hematoxylin you see in stain slides, which you see everywhere. But the top one is a special stain. We call it trichrome stain. In this, you can see all the blue color is because of the collagen. We'll see more of this. This is a special stain. So this thing occurs, the repair by fibrosis, healing by fibrosis occurs in these examples, like healing of the wounds, healing in inflammations, healing of a thrombus or thrombosis, or healing in a necrosis. When the cells die, necrosis, you know, when the cell die in organs like heart and other area, then there'll be no regeneration. There'll be granulation tissue formation and then scar formation. So these are the examples or the sites in which granulation tissue is formed. So granulation tissue is important. It is formed in 4 processes. There are 4 steps in the formation of granulation tissue and scar formation. The first 2 steps are for granulation tissue, and the remaining two steps are for the scar tissue. So first step is called angiogenesis. Angio means blood vessels, genesis means production. Angiogenesis means new blood vessel formation. But actually, it is new angiogenesis means new blood vessel formation. Angiogenesis means blood vessel formation. So in this, you can see this is the blood vessel is like this, and new vessel will come as a bud. They will start. They will break down the basement membrane. This yellow line is the basement membrane. It will break down, and then these endothelial cells. They are blood vessels are lined by the cells called endothelial cells. They'll start migrating out from this gap. They migrate out, they proliferate, and then they mature. Maturation of endothelial cells means they canalize and anastomose. They develop canal, and this is the process which occurs, and new blood vessels are formed. A lot of new blood vessels are formed so that granulation tissue can start. So this is the first step, is angiogenesis. In the second step, we get proliferation and migration of fibroblasts. Fibroblasts, as the name is suggesting, is fibrous tissue forming cells. These are the blast cells that form, they lay down the collagen, they deposit the fibrous tissue or the collagenous tissue, and many growth factors are involved in this process. Many chemicals or the growth factors are involved. The two given here are the fibroblast growth factor and cytokine IL-1. You know what is IL? Interleukin-1, okay? So the first interleukin-1 is one of the cytokine involved in the growth of fibroblasts. They help in the proliferation and migration of fibroblasts. They are normally present under the skin and all over the body. They are all also sleeping. But when there's a requirement, they become blast cells. Then they start doing their work. So these first two steps are for the formation of granulation tissue. Sorry. So what is granulation tissue? This is a very important thing all over the life as a doctor, as surgeons. When you see, you'll talk about granulation tissue. So this is how it looks like grossly with naked eye. It is pink red in color, soft in consistency. It is called granulation tissue because it looks granular. You see, it's look granular because a lot of blood vessels and capillaries looping around. It looks like granules. And it bleeds easily because, again, because of lots of blood vessels, capillaries in it, but it is insensitive to touch because there are no nerves in it at this stage. The granulation tissue is insensitive to touch. It's not painful. It will be painful if you press hard because then other nerves are affected. Itself, there are no nerves and it is insensitive to touch. These are the gross features. Under the microscope, histologically, you see a lot of these blood vessels. These are the new blood vessels, all these filled with RBCs. All these are new blood vessels and the proliferating fibroblasts. These thin arrow is the pointing towards fibroblasts. Now they are normally fibroblasts are just thin cells, but to lay down collagen to become fibroblasts, they become thick and having large nucleus. We'll see in a higher power. Then there's loose extracellular matrix. Between these two structures, blood vessels and fibroblasts, the area is loose because a lot of plasma protein which is leaking out of the blood vessel because this cells need a lot of nutrition. They need a lot of hormones and nutrients so that the area is containing a lot of plasma proteins and nutrients so that it looks like loose. And then on this side, on the left side, is the ulceration and inflammation. So you can see in the granulation tissue inflammation also on one side, and on the other side it is dividing and growing. This is the high power. You can see a lot of these blood vessels filled with RBCs. Even the small ones are capillaries dividing, and these are the large plump fibroblasts. You see these fibroblasts. Normally they are just like these thin ones, but during activity they become thick and having prominent nucleus, just like malignant cells. If you don't tell anyone, this could be misdiagnosed as a malignancy also. So they are so actively dividing. The third step is called synthesis of collagen. Now the fibroblasts have come. Now they will do their job to deposit collagen. See these fibers are collagen fibers. Collagen, you know, is a protein present in the body and more important in this function. So these blue fibers are the collagen which has been deposited. Originally in the beginning, they are deposited randomly, right, left, Shumal, Junub, everywhere. So it is dividing irregularly, deposit irregularly. And now the blood vessels are now decreasing. There's devascularization. You saw the first pictures, there are a lot of blood vessels. Now the blood vessels are decreasing. This is reabsorption of the temporary vasculature. It is called devascularization. And finally, this is the last stage in which the collagen is all deposited. It's all blue because all this is collagen now. And now they will try to be in line. They will realign wherever there's more pressure, more stress, they'll go in that line. We'll see in the diagram also, collagen fibers, they realign with the stress to strengthen the site, to increase the strength of the repair site. So that is a good phenomenon which we'll see in the diagram. And sometimes when the wounds are large, when they are large wound, collagen will come. Then the scar will also contain myofibroblast. The fibroblasts also have the property to contract. So they'll try to decrease the size of the wound. This is called wound contraction. This occurs only in the large wound. The small wounds are already small, so there's no contraction. In the large wound, there's scar contraction also. And see the blood vessels are almost decreased, only blue collagen is left. So some of the people, they call
Doctor,
slightly, yes?
could you
Yes.
please repeat the part of devascularization?
Yes, devascularization means, you see, if here you lot of blood vessels in the beginning, the granulation tissue has a lot of blood vessels because many blood vessels, because the tissue needs oxygen, nutrients, glucose, proteins, and hormones and all things. So many blood vessels in this picture. All these are blood vessels. Then slowly and slowly here also is high power. But then you see blood vessels are decreasing. Now they decrease in the number of the blood vessels are now less and more collagen is deposited. The blue fibers are the collagen is coming. So this is called devascularization. And in this step, you see more collagen and less blood vessels. This all process is called devascularization. And this is an extra function, is that contraction is different. It is the size of the scar is decreased by the fibroblast. Is it clear now?
Yes, doctor, thank you.
Okay. So some people, they give different names to all these steps. They said, okay, there's a removal of the debris. Okay. Sometimes there is inflammation and healing going together. That is the definition of chronic inflammation, when healing and inflammation going together. So there's removal of debris. Then the granulation is formed, granulation tissue is formed, which is vascular. The first pictures. In this, there are a lot of blood vessels. So it is vascular granulation tissue. The third step, they call it fibrovascular granulation tissue. Means there are fibers also and there are blood vessels also. This is something extra which is not in your textbook. Some people have made these slides, so that is why I'm not removing it, because it was in the original file. And then the fourth step is fibrous tissue. And finally, collagenous scar. I don't see the difference between the two. Fibrous tissue and collagenous scar, we cannot differentiate. At least I cannot differentiate by definition, theoretically or practically. So there's fibrous tissue in the stage 4 and collagenous scar is stage 5. This diagram is explaining the problems in the definitions, because whenever this inflammation starts, suppose it is remaining at least 3 days, it may remain for 1 week. When there's inflammation, granulation tissue will also start within, say, 8 to 10 hours and in 1 day also. So there's an overlap. So in this overlap, you see that in the granulation tissue, there's inflammation, also granulation tissue. Both things are present. So that is why there's confusion that inflammation, we saw in the picture also, inflammation is also present and granulation tissue is also present. But after 3-4 days, inflammation finishes, only granulation tissue and healing occurs. Wound contraction occurs in the large in the large wound, when the size of the wound is large, then the wound contraction occurs in about 1 month's time. It's slowly and slowly, the size of the wound becomes small. And the collagen is going up and up. You can see this remodeling and collagen is going up and up, even till 100 days or even more. Many months are required to complete this. So this, we have to understand the time course. What is the time? What happens in the first 24 hours? What happens in 1 week? What happens in 1 month? So this is called time course, or we know in the, what you call in the Facebook, etc., the timeline, they use the word. It is also used in our lecture. So to understand the time course of healing and the amount of scar, some conditions there's very little scar, in some conditions there's a lot of scar. We have to understand there are many factors involved. So to understand all this process, we are using the example of skin again. We are using the example of skin wound healing, and we come to know that there are two types. There are two types of wound healing. One is healing by primary intention, also called healing by first intention. The second is the healing by secondary intention, or healing by second intention. So these are just the names of the two types of wound healing. And for that, we take the example of skin. And this diagram is self-explanatory. They also use the word first intention healing here and second intention healing. In the surgeon, as inshallah you'll be surgeons, you do the surgery, you just make a small incision here on the forehead. You just bring the two margins close and you suture it. So there's no loss of any tissue, very little damage. So this is the first intention healing. The second intention healing is the natural one. When someone falls on the ground, there's injury, there's big wound here, and that gap has to be filled in time. It takes time for that. So this is called second intention or secondary healing. So we look at the timeline of the, yes?
The difference but in the بس الوقت يا دكتور in the time just
The difference will be the time and the amount of the collagen, etc. We'll see. Now we are looking at it. We'll do this 2-3 times. Don't worry. Okay, but you will understand this with the diagrams now. I was just telling you the definition. Now you see, look at the timeline of the first intention. This is a good diagram to explain, and we'll try to explain you more clearly. So the main difference will be, if there's no loss, the tissue will be healing quickly within weeks. But if there's big loss, then it will take months. Okay, this is one difference. An amount of collagen will be less in the first intention and more in the second intention. We'll see all this in the next slides. You will get bored listening to this again and again. Don't worry. Sorry, this doesn't come again. Right. So within 24 hours, you know, Dr. Ahmad was telling you about inflammation, acute inflammation. So whenever the surgeon gives a cut here, there'll be bleeding, clot is formed, and when the clot gets dry, the dry clot is called scab. So the top will be the scab to prevent any bacteria or anything to go in. So the neutrophils will come. You see the neutrophils have started coming in this area. And then endothelial cells. Endothelial cells, you see these blood vessels here? It is lined by endothelial cells. They'll start proliferating, and there'll be angiogenesis, the first step. Then fibroblasts, which are present here, they are sleeping. They are sleeping and called fibrocytes. Normally they are called fibrocytes. They are not doing anything. They are just waiting for any emergency. Like we have the fire brigade, the fire madani, etc. They are not doing anything, but then they become active because of all these growth factors and interleukins and cytokines. They become active and they migrate and reach to this site. So this happens within 24 hours. There'll be neutrophil will come, clot will be formed, scab will be formed, endothelial cells will proliferate, fibroblasts will immigrate to this area. They will reach and see these fibroblasts, they are coming to this area. And by 3 to 5 days, macrophages will come. You know, the macrophage, they take some time. They are the big cells. Macrophage means eater. They are the big eaters. They take time to come. And then slowly and slowly, within 3 to 5 days, we get this granulation tissue formation. New blood vessels are coming, fibroblasts are coming, macrophages are coming. And at this stage, the collagen starts to bridge between the incision. They form a bridge. The collagen, we see that in another diagram. They will form a bridge to bring the margins close. The epithelium will also start dividing. You see the epithelium will start showing mitosis. You see the mitosis in the basal cells of the epithelium. The stratified squamous epithelium of the epidermis now is showing thickening, and there is mitotic figures in the epithelium. Then it takes about many weeks depending on the person also. Suppose the healing in an old person is slow, a healing in the young person is fast. Healing on the face is fast because of the blood vessels. Healing on the foot is slow. So these factors we'll see again later on. So it takes time to form this dense fibrosis. The dense fibrosis is called scar, and later on remodeling also occurs. We'll see the phenomenon of remodeling in another slide. So it's clear. So within 24 hours, these changes occur. 3 to 5 days, these changes occur. And after weeks, this is complete now. So again, in this diagram, this is the diagram of your original lecture. So when there is surgical incision, when it is clean and uninfected, tissue damage is minimum, then there's just disruption of the basement membrane and few epithelial cells are lost, and the edges, the wound edges are closely approximated by sutures by the surgeon. So there'll be very less problems. This is called healing by first intention. So there's more regeneration of the epithelium and less fibrosis, very little scar in this condition. So in the healing by first intention, because everything is clear, no problems, so healing will be less. Within 24 hours, again, neutrophils will come, the basal cell will show mitosis, and there's slowly a complete line is formed within 24 to 48 hours.
Doctor,
Yes.
what is the mean scalp?
Scalp, yes. Scalp, I told you, scalp means when the blood clot, you see, whenever there's injury, the blood clots, and when it is on the surface, you don't touch it, you don't remove it, it will get dry. Okay, when the clot gets dry and it contains less RBCs are only plasma left, that is the scalp on the surface. Scalp is the dry area on the surface of the cut. It is usually because of the clot. Okay, you can see the arrow. Scalp is at the top. It's the dry clot. When it gets dried on the surface, it is called scalp.
It's benefit, doctor?
Sorry?
It's benefit for us?
Yes, of course, it is kind of temporary epithelium. It is preventing bacteria to go in. It is preventing any water to evaporate and the nutrients to go out. It is a defense system. Okay. So as just like clot, whenever there's a bleeding, the clot comes to block that blood vessel and bleeding stops. Similarly, when there's a cut on the top, the blood clot comes here and dries. It will dry. It will become dry and it will be there. And if you leave the scalp there, whatever the process, healing process happening in the depth, then this scalp will become small, and it will fall down. But if you break this scalp, it happens that the children, they get these injuries, they get scalp on the surface. They try to damage this. They try to remove the scalp, that dry thing, the hard thing. Then again, bleeding starts. You remember, it happens. It's a normal thing for the children. If they fall after bike or something, on the knees, on their foot, they have this scalp formation, bleeding first and then scalp. And after 2 days, they try to remove that scalp. Oh, it's not good. I want to remove it. When they remove, again, bleeding starts. So it is beneficial for us. Okay.
Okay.
So again,
Thank you.
Okay. So then the third day, again, macrophages come. They replace the neutrophils. Granulation tissue is now formed. Blood vessels are dividing. Collagen initially is vertical. See, these green things, they are showing that collagen is vertical, just to make you understand. But it's actually random. It is in all direction. But later on, more important that this collagen should be horizontal so that it can bridge the gap. So this is important. See this green line? So now the collagen like thread, like the Hayat, they build the cloth So it should be horizontal so that the wound should not open. This is called remodeling. Remodeling towards the stress. The stress is like this, so collagen will become like this in after 1 week. In the beginning, it is random, every direction, but later on, it is like a bridge between the two ends. It becomes horizontal along the stress. In the second week, you see the blood vessels are now disappearing. No blood vessels, only fibrous union, little bit of fibroblast, but this is all collagen, which is the scar present now. The epithelium has also grown up. The scab has also fallen down. The scab becomes small and then falls down. Epithelium comes and covers the wound. Now coming to the healing by second intention, it occurs when there's extensive loss of tissue. When there's lot of tissue is lost, for example, in the heart attack, infarction, in any death of the tissues, infarctions, ulcerations, abscesses, and large wound. You know all the definition of all these things? You know what is infarction? Anyone?
Yes.
Yes,
Okay,
in
good.
the
Mashallah.
myocardium cells.
Okay, it happens in the heart or in the brain. Infarction is the death of the cells due to loss of the blood supply. You don't get the oxygen blood supply, the tissue dies. There's a difference between infarction and necrosis. I will not go into the detail. So necrosis and infarction are different. Necrosis under the microscope, infarction when you see from the naked eye. Ulceration, you understand, abscess, you understand, large wounds. So whenever there's large damage, there'll be healing will be by second intention. The mechanism is same, but there are some differences. Differences are there's more inflammation in the large area. Of course, there's large damage. There's more inflammation. There's only 2 blood vessels here. Yes, here you can see that 8 to 10 blood vessels are there. More granulation tissues formed, and wound contraction occurs. You see this? Wound contraction does not occur in the first intention because it's already small. But in the second intention, the wound becomes small. It is contracted by the help of myofibroblasts. So this wound contraction can only occur in the large wounds in the second intention healing, not in the first intention healing. So these are 3 main differences: more inflammation, more granulation tissue, and wound contraction. Again, this is the same thing. If the defect is more, there's intense inflammatory response, and there's a greater scar formation, more granulation tissue, more scar formation, and there is wound contraction. About 5 to 10% wound contraction occurs because of the myofibroblast. Wound strength is a small topic we have to just quickly go through. Is figures to remember that whenever there is a wound in the skin and the surgeon, they suture it, then there is 70% strength left in that wound. Not 100%, only 70%. But after 1 week, after the sutures are removed, if you try to test the wound strength, it is only 10%. In 3 to 4 months, it takes so much time, you see. Even in the incised wound, in the simple wound, it takes 3 to 4 months to reach 80%. It never becomes 100%. Sorry. So this is about the wound strength. In 3 to 4 months, it becomes 80%. Again, we just quickly revise. The healing by second intention occurs in the larger wounds, which are less linear, they are irregular. When the edges are not opposed, they are not close, the edges are far, or when there's infection in these wounds, all these are the causes or the conditions in which there is healing by second intention. And then, of course, wound contraction has been mentioned, and more granulation tissue has been mentioned. And in these wounds, there's more chances of infections and more inflammation. So same things, third time in writing. Again, fourth time, this table is giving you the differences between primary union. Now they have used the new word, primary union and secondary union. I'm not going through them. It's simple. You can read them whenever you want to at your own time. So this is a histology picture. It's a simple histology picture that how the scar looks under the microscope. See, this was the skin had the scar. Now this you can see the difference here. Just at the bottom, you can see this is also collagen, thick collagen, but slightly different from this collagen. See, so this is the scar. This is the scar which also has some blood vessels, some cells. It's like bluish, and some blood vessels also. And this is the original dermis, the collagen of the dermis. Here also you can note that the epidermis is more because of the reaction, because of the growth, the epidermis is thick. So all these are features which you can see under the microscope. More will be told to you in the practicals if Dr. Muvala can. I hope she'll tell you more. So what are the mechanisms? There are three mechanisms which are involved. One, of course, we know about the growth factors. We have seen the fibroblast growth factor and the interleukin-1. So these are the growth factors. There are so many growth factors in the body, controlling all the processes in the body. They control the cell migration, the cell proliferation, and the angiogenesis in this case. How they do it, we cannot go into the detail, but just to remember that they do it by gene transcription. They stimulate the genes which are responsible for the production of those special things. So they control the cell cycle, they control the gene transcription. So there's a long list of growth factors. There are few written here and few written here. I think you can read them easily and there's nothing to explain about them. Or should I quickly go through that? The epidermal growth factors, they stimulate the division of epithelial cells and fibroblasts. Clear? PDGF is interesting. It is platelet-derived growth factor. It is called platelet-derived growth factors coming from the platelets. They induce fibroblasts, smooth muscle cells, monocyte, and here it is written produced by activated macrophages. See, initially when it was found, it was discovered in the platelets. That's why it got the name from the platelet-derived. But now they come to know that mainly it is coming from the macrophages. So just don't get confused that the name is different and the origin is different. So it is produced by the activated macrophages and also by the platelets. So that is why the name was given in the first part. Then vascular endothelial growth factor will cause the stimulation of angiogenesis, TGF beta, TGF alpha, all these are the growth factors that are responsible for the stimulation of healing and repair. The second mechanism is called kelons. Kelons are some molecules. There are the peptides which inhibit growth. They inhibit the mitosis in the neighboring cells. Kelons, they are in growth inhibiting. They stop the growth. So normally they are present in the tissue, so they will not allow the division to occur. They will not allow the mitosis to occur. But whenever there's injury, whenever there's tissue destruction, the level of kelons will fall in that area. The level of these molecules will decrease, and when the level of these molecules is decreased, mitotic activity will increase. Is it clear? They are the inhibiting peptides normally present in a tissue. If they are present, there's no mitosis. There's no mitosis. But when these tissues are damaged, they are destructed, they are killed, then the level of the kelons will decrease. There's decrease in the level of kelons, and therefore mitosis will increase and healing can occur. So this is one of the mechanisms of repair by the method of molecules called kelons. The third method is physical. This is by physical presence of the cells. You see, this is a complete row. When there's complete row, naturally no cells can come in the middle. Just like we pray Salah in the masjid, of course, when the row is finished, then people go in the second row. They could not try to come in the same row, more people. So there's fixed 6 cells in this line. 2 are died. 2 have died now. There are gap in this out of 6 cells. 2 have died. Now the growth will occur. This is called contact inhibition. Normally, they cannot divide because they are in contact with each other. They are in contact with each other, so no growth, no multiplication. But there's damage or wound, there'll be no contact. When there's no contact, the cells will divide and complete the row. This is called the phenomenon of contact inhibition. ECM is also very important. Extracellular matrix. Extracellular matrix is of two types. One is in the between the cells, and one is the basement membrane on which the epithelium is sitting. And this is the list of the functions, more of physiology, not pathology. What are the functions? I'll quickly go to the next slide. This diagram is explaining the importance of ECM. This is the liver lobule, normal liver lobule, and this is the high power of that. If there is injury to the cells, the liver cells are dead. Suppose this is the example of viral hepatitis. When the virus cells, they damage the liver cells, viral hepatitis, then only the cells are damaged. The basement membrane and the extracellular matrix is not damaged. Okay, only the cells are killed. So regeneration will occur completely. The livers become normal after the infection. So there's no scar formation. But if you look at here, if there's a liver abscess, bacteria, they produce a liver abscess, it will kill the cells of the liver, also damage the matrix. They will also injure the matrix. Now, this healing cannot, regeneration cannot occur. Now the repair will be by fibrosis. So this is so important. So if their matrix is present, then complete regeneration can occur. When the matrix is damaged, like in the abscess in the liver, then fibrosis will occur. There'll be scarring will occur. This is a very good diagram to explain the importance of extracellular matrix. Cells cannot regenerate without the presence of extracellular matrix. Finally, the systemic factors. Age is important. Healing is slow in the elders. Okay, these nutritional substances, proteins, vitamin C, zinc, and calcium are important for healing. Cortisol will decrease the healing. Whenever some person is using cortisol as drug, then healing is decreased. In diabetes, healing is decreased. In arteriosclerosis, healing is decreased. Ionizing radiation will decrease the healing, and all the cytotoxic anti-cancer drugs will decrease the healing. These are the systemic factors. Local factors, you can see that we have put an example of a pilonidal sinus. This is a pilonidal sinus. This occurs between the two, it occurs between the two buttocks, hips. Usually hair from one side, they go into the skin of the other side. So the hair is pilonidal, means because of the hair, this cyst is formed. It takes a lot of time to heal. So this is a foreign body here. See, this is the hair tissue, hair in it. So the cyst is formed, and that will decrease the healing. Foreign bodies, any foreign body, sutures, glass, bones, they will decrease the healing. Any infection will decrease the healing. We know about whenever there's bone fracture. Whenever there's bone fracture, we put a plaster cast. We put a plaster cast so that the bone is not damaged. Bone is still, it is fixed, and then healing will occur. But if we keep on moving the bone, the healing will not occur. So if the area is made motionless, then healing will be fast. If there's any motion in that area, then the healing will be slow. So any damage, any injury near the joints will cause decrease in the healing. Size is clear, we have seen just now. If it is an incised wound, the surgeon does the incised wound, the healing will be good. If the surgeon does an excision, removal of a tissue, then healing will be slow and it will take time. That will be by secondary intention. Location, I told you in the beginning, it is fast on the face because of more blood supply. Healing is slow in the foot because of the, again, blood supply. If the wound is sharp and clear, clean wound, no damage in the surrounding tissue, it will be sharp, it will be quick. And if the wound is blunt with a lot of injury, then it is slow. So these are some of the complications because of the inadequate granulation tissue. One is called wound dehiscence. This is a poor thing happens in the surgery, abdominal surgery. When there is an abdominal surgery, this was a lady of cesarean section for the birth of the baby. Cesarean section was done, but she also then developed vomiting and coughing. So that is the reason the wound could not be made still and motionless, and that kept on breaking. And this process is called, opening of the wound is called wound dehiscence or wound rupture. This occurs in complications of the abdominal surgeries. Ulceration is example in which there's inadequate granulation tissue. Sinuses and fistula formation are also complications of the healing. Because I teach lectures in the dentistry college, you can see that this was the example of tooth abscess. A tooth abscess was appearing as a sinus here. You know the difference between sinus and fistula? Anyone knows the difference between? Sinus is a tract, inflammatory tract, which has only one opening to the outside. Fistula is an inflammatory tract which has opening on two sides. See, here this is the fistula between sigmoid colon and the bladder. It's in the uterus. Yes, it's the uterus. So it is in two cavities, either on one cavity on the surface or between two cavities. These are the fistula. So it connects two cavities. So this is uterocolic fistula. There's always recto-vaginal fistula. All these are when they connect two surfaces. Sinus connects only one surface. The other end is blind. It is closed. And this is the specific complication of healing. Specific means related with the healing process. Sometimes the scar becomes hypertrophic. There is increase in size of the scar. This is the example. It is more on the surface. It should be on the level of the surface, but you can see it has gone above the surface. This is called hypertrophic scar. But more dangerous or more serious is the keloid. You see, what do you think this lady got there? This is a girl, but now the boys also do it. This is the ball of collagen which is after ear piercing. Of course, the girls, when they are small, they get these ear piercings for their earrings, golden earrings. So this lady got this ball of collagen at the site of just that needle mark. So this is keloid. So in the keloid is a complication of healing in which excessive collagen is formed. Excessive collagen formed, which is beyond the boundary of original wound. See this hypertrophic scar in the boundary. This is in the boundary of the wound. It is just raised above the surface. It is hypertrophic. But keloid will go above, beyond. You understand the word beyond? It should be just at the base of the hole, but it's become very wide. So this is called keloid. It occurs in the African races, more common in the African races. And I think keloid means a crab. It has a claw shape. There are many pictures for that also if you want. So there are two important complications. Excessive collagen. One is hypertrophic scar, the other is keloid. And finally, because, yes?
Is hypertrophic scar harmful for the person?
It's not harmful, but if it is at a place which is important, like near the joint, etc., then it is important. Otherwise, mainly cosmetics. Hypertrophic scar, they are not they're dangerous, because now look at this. Instead of earrings, the lady is wearing this, having this ball of collagen. So this does not look nice. Otherwise, it's not that much important. Because they have only collagen, they do not have any cells. If they have cells in it, many cells, then it is neoplasm. See the tumors and the neoplasm, that cancers also are like this, but they contain only mainly cells. Here it is only containing collagen. So that is the difference. So they are less dangerous, mainly cosmetic defect. Okay. And finally, this is the last slide of contractures. When there's excessive collagen deposition or when wound contraction occurs, and especially in the joint areas, then the function is affected. Now this is dangerous, that function cannot be done. He cannot use the hand now. And here the neck is, it usually happens after burns, mainly. that excessive collagen is deposited and that the neck movement is affected. So this complication is called contractures. Okay, thank you very much. Now I think Dr. Ahmad requested that he needs some time. So I'll let him know that I've completed my lecture. Any questions?
Doctor, can you send the slides, please?
This one I've sent to Muhammad. I told him to give to all the students. It's the same lecture, content is same, except that I made it taken to the beauty parlor. You know what is beauty parlor? So these are the actual slides which I teach to the dentistry students. They have with proper one. The slides, the file which Dr. Ahmad uploaded to the e-platform was almost same. It's the same material, except it was I made it more of the same proper way. Muhammad has got his file. I think it should be on your group. Okay, Muhammad.
Okay.
Please
Yes,
give to
Doctor, he
Dr.
sent
That's
it.
included.
He sent it.
You have sent to the group. Okay. Thank you very much. Ma salam.